Good evening and thank you for joining KREM 2 News at 6 tonight. I'm Mark Hanrahan. Today is Monday, April 13th, although every day kind of feels like Monday right now. Hard to believe, but we are in week 4 of social distancing, so I continue to broadcast from my home. In the meantime, our Whitney Ward is back up at the studio. Whitney?
It definitely feels like an endless array of Mondays. I'm just holding out hope that it's all going to end soon. Good to see you. Hope you guys had a good Easter. Hey, we are hearing from a different kind of worker tonight on the front lines of this coronavirus outbreak.
I don't know many people on our team that haven't put in, 60, 70, 80 hours a week.
Epidemiologists, their job right now is critical. It's called contact tracing. They're the ones figuring out who's sick and who they came into contact with. Here now is KREM 2's Taylor Vito with more from the Panhandle Health District.
I don't know if you can see it. This is a pretty giant coffee cup.
That's just one way to describe the kind of long hours Nick Swope and his team at Panhandle Health have been putting in. They're not the ones treating coronavirus patients per se. Rather, they're doing some detective work on the back end.
I often describe it kind of like Sherlock Holmes, but you're essentially trying to solve a case, a mystery where we have partial information.
Swope heads up the health district's team of epidemiologists. Epidemiology is a branch of medicine relating to how diseases spread, and Swope says his team works with patients to help track where they've been and who they may have come into contact with. All important work as efforts to curb the virus's spread continue.
If we're looking specifically at coronavirus, really we're looking at close contacts.
But what makes the current situation unique is how much it's evolved, he adds. Swope says part of an epidemiologist's job is to study and keep up to date on the latest virus trends.
It's changing so much and it's changing so fast.
And that's led Panhandle Health to quickly ramp up their epidemiology team. You see, normally the district's team has just 2 full-time staff members for all of North Idaho. Now the team has about 15 people. Panhandle Health has been cross-training several of their employees.
That goes from everywhere from our clinical nurses to environmental health specialists to some of our health educators.
The team is working 7 days a week, with most employees putting in 10 to 12-hour days. But the hard work, Swope says, could be paying off. A week ago, Panhandle Health was reporting 44 cases in the 5 northern counties. At last check, that number had increased by just 4, and only Kootenai and Bonner County had cases.
I could be a little optimistic, but I think we're starting to see the real benefits of really good social distancing.
So for now, the team says please give them less work to do and do your part to stay healthy. Taylor Vito, KREM 2 News.
Well, the IRS announced over Easter weekend the first coronavirus stimulus checks are already being deposited into some taxpayers' bank accounts. So we want to hear from you right now. Just go to krem.com/vote and let us know if you've already received your payment. For now, we want to head to Regina On, who is live in the newsroom now with more on that. Regina?
Yeah, Whitney, so the $1,200 deposit was likely a surprise for those of you who received it a few days earlier than expected, but the IRS isn't done making those deposits and sending checks out. By Wednesday, April 15th, tens of millions of Americans should have their checks already. Now, the people getting their first are the ones who filed tax returns in 2018 or 2019 and received funds through direct deposit. People who didn't file taxes, are very low income, or are older and don't need to file will have to wait for their money. Any paper checks should go out starting early May. The IRS is working on a web portal, and they'll also be letting users check the status of their stimulus payments there as well. The IRS expects this to launch by this Friday, April 17th. And the IRS has also launched a web page to allow non-tax filers to provide the federal government with payment information. So, as you asked earlier, we did ask you to vote whether or not you have received your payment, and here is what those results are. The majority of you did not receive your payments. It looks like about 20% of you did receive your payments. So like we said, a lot of you, and myself included, we're still waiting on those stimulus checks, so we'll have to just stick around and wait. For now, in the newsroom, back to you, Whitney.
All right, Regina, thank you very much. And if you do have questions about the relief package or unemployment benefits, right now all you have to do is text the word money to us here at KREM 2. Just text us money, 509-448-2000. The number of coronavirus cases at the Spokane Veterans Home is growing. At least 12 residents have tested positive so far, and dozens of staff members also got tested this weekend at the drive-through testing location at the Interstate Fairgrounds. So here's what we know right now. A total of 84 veterans live at that home. 18 have been tested, and we know at least 5 were showing symptoms over the weekend. Also, 5 tests came back negative. At least 1 is still pending. We also know all residents in the facility are being checked for a fever or other symptoms every 4 hours. One patient who tested positive for coronavirus died from the Spokane Veterans Home last week. Before that, at least 1 employee was also tested positive. That person returned to work for several days before they started showing symptoms. Now, it's important to note the Veterans Home is managed by the State Department of Veterans Affairs, not the federal government. It is completely separate from the Spokane VA Hospital. Right now, state officials say all of the positive tests have been located in one area of the facility, and they're working really hard to keep it from spreading. They're also working to get on-site testing available for employees and residents. In a statement, here is what Patrick McNabb said today. He's the administrator of the Spokane Veterans Home. I reached out today and he said it is heartbreaking to face a challenge like COVID-19, especially since it's something we've never dealt with before. He said, I worry about the veterans, their family and loved ones, and our employees and their families. It's important that we are transparent and provide updated information so family members and our community know what's happening. He says this is especially true when they cannot come visit, so we owe this to them. I'm grateful for their understanding and their support in knowing we are doing everything we can to protect our veterans and reduce the spread of this disease. You can find his whole statement as well as more information about this outbreak at the Spokane Veterans Home. Just go to our website, KREM.com.
It is hard to believe, but next month marks the 40th anniversary of the eruption of Mount St. Helens. Nearly 60 people were killed and more than 200 homes were destroyed. KREM 2's Brandon Jones has more now on how that anniversary is being remembered here locally, plus some of the lessons learned.
Next month, May 18th, marks 40 years since an absolutely historic event shook the Northwest. Kids were out of school, people were unable to go to work, and every time you stepped out of the house, you had to put a mask over your face. The circumstances were similar to what we're experiencing today with the coronavirus, but only then it was a volcano that was the cause of mayhem. An exhibit honoring the anniversary of Mount St. Helens sits inside of the Northwest Museum of Arts and Culture. But with the stay-at-home order in place, there's no one around.
The eruption of Mount St. Helens in a lot of ways really triggered a lot of the plans and protocols and investments, into responding to, massive natural events.
While doors are closed, the museum is doing a 40-day countdown of personal stories and images from that year. They're asking for people to submit what they experienced during and after the volcanic eruption in hopes of adding them to their exhibit once it opens back up.
You really get a good idea to try to understand what those events might have been like for people, especially through what we're experiencing right now.
Dust traveled throughout the region and even gave areas like Spokane up to a foot of ash. But who would have known that 4 decades after plumes from the mountain forced people to stay inside of their homes, that we'd be doing the same thing right now for a different reason?
I think one of the key ironies of history is, we're always repeating it. If you look at the pandemic in 1918, plus the eruption of Mount St. Helens, you're going to see that imagery of the masks coming up, the same as we're witnessing today.
To share your story with the museum, you can text the word story to 448-2000. From Spokane, Brandon Jones, KREM 2 News.
If you were anywhere in the Pacific Northwest back on that date in 1980, you likely remember kind of where you were, have some stories about what you experienced in the aftermath of it all. Tom, I wasn't around during that time. It happened right before my time, but I remember you telling me some stories about kind of what you experienced in the aftermath of the eruption.
It was nuts. I mean, it was crazy. We heard that the mountain had blown, and I was living out in the Medical Lake area. And I'm telling you, it was the weirdest thing. It got dark at like 2 o'clock in the afternoon, and then we were stuck out in the Medical Lake area. I couldn't even go to work because the freeways and everything was just shut down. And we had like longtime residents know what I'm talking about, almost an inch of silt all on the freeways. And I remember after about 3 days, I remember going to the store in Medical Lake, and all the beer was gone, all the hot dogs were gone, and all the bread was gone. And I'm like 22 or something at that time, so you know where I'm looking, right? But I mean, my gosh, it was just crazy. And then I remember driving into town, and only one lane was open, and there were police everywhere trying to keep people from, getting off on certain off ramps. And it's just the kookiest. We didn't know if it was going to harm our cars. We were putting handkerchiefs in our around our air cleaners, and it was nuts. It was crazy. And then later on, I had a friend of mine that actually used the silt as a glaze and made me coffee cups. And I wish to gosh I had thought far enough into the future to keep those, but during one of my many moves, they disappeared. And Mark Hanrahan and Whitney, Mike Sherry, my son, my oldest boy, happened to be born on May 18th of 1990. Other than the date, there's nothing tied in, but I never forget May 18th, right?
Yeah.
Okay.
Yeah, there you go.
Let's do this, shall we? Yeah. 53 degrees, gang. That's the current temperature out there. We've got partly cloudy skies. Increasing clouds are expected for tonight. We'll be mostly cloudy in the overnight hours. When you take a look at the day planner forecast, we'll go for an overnight low of 36 degrees, 62 the expected high on your Tuesday. And I think we're going to get some rain in northern Idaho and western Montana by this time tomorrow night. I'm not going to rule out a shower even here locally, but the daytime hours will be dry, and of course it will be warm. And then look at the weekend, almost 70 for both Saturday and Sunday. I'll check your 10-day forecast coming up in a few minutes.
All right, thank you very much, Tom. We'll talk to you shortly. Among the group of people being hit hard by the coronavirus pandemic is actually college students. It's why the WSU Pullman Student Government Group started a grocery reimbursement program. KREM 2's Amanda Rowley has more now on how it's helping.
The Associated Students of Washington State University is supporting Pullman students who are struggling during the coronavirus crisis.
College students really are getting hit really hard. Obviously, a lot of college students are the people that work those service industry jobs that are being cut. And on top of that, college students are the ones that aren't getting anything from the stimulus package that just got passed.
The group decided to help alleviate the cost of basic needs by launching the Grocery Reimbursement Program. WSU students shopping at Dismore's, Safeway, and Walmart in Pullman qualify for reimbursement. It is good for 50% of the first $50 they spend each week. ASWSU provided a list of what foods are eligible for reimbursement, along with items that are not. To get the reimbursement, students fill out a form online and include photos of their receipt, Cougar card, and contact information.
Hey Cougs, Quentin Burkompus here, ASWSU President.
ASWSU President Quentin Burkompus posted this Twitter video to get the word out, and that word reached WSU senior Audrey Maddox.
It was really simple, very short process.
Maddox returned to the Pullman campus for work at the university, but later learned her shifts are now temporarily suspended.
Well, I'm already paying rent, so I might as well just be here.
She says if it were not for ASWSU's grocery reimbursement program, she would be in a much more difficult situation.
I was kind of getting worried about it, just because I'm not working, you're not getting money from that. I tried to apply for unemployment, can't get that either. Because I wasn't really expecting any help from anything. I was like, well, I just have to stretch my money, figure it out. But then when I saw this was just really nice. It definitely helps a lot.
Amanda Rowley, KREM 2 News.